Well, hello everybody. My name is Diane Tribble. I'm with Aging and Adult Care of Central Washington. And thank you so much for inviting me. I'm honored to be here. You have a pretty wonderful lineup of speakers, so I'm appreciative of being included in that lineup. So I'm the Director of Information and Assistance at Aging and Adult Care. It's one of our departments. And basically, Debbie asked me to write a little biography about myself, so I'll just tell you my experience with living with aging is very connected to my parents, and particularly my mother. She was diagnosed with Alzheimer's in 2002, and even before that, we had some indication that something was going on. She was struggling, and then she was diagnosed by a neurologist in 2002. And then we went through all of the different levels of care that a person might experience with that disease and with other chronic illnesses. But we started out with hiring people to help her in the home, because my father was already deceased. So we had caregivers come in a couple days a week, and at first it was just to take her out and do a little shopping, get out of the house, and have lunch, things like that. And then her needs, her care level increased, and we having caregivers come in the home wasn't quite enough. Even though we started having the caregivers come in more often, she just wasn't managing, and her memory was on the decline. So we sold her home, we moved her to an assisted living, which she really enjoyed for the time that she was there. She had a lot of fun with all the activities and going to the casino in Mill Bay and the senior center to go dancing, all of it. And then she started doing what's called exit seeking, which in her case, towards the end of the day, when all the activities had ended and it was quiet, she went looking for her family. That's what she would say, well, where's my family? And she actually went out the front door a few times and down the street. And assisted livings are not secure facilities, right? They're not memory care, not designed for that level of need. And so they told us, administration, we can't serve your mother's needs here any longer. And I started looking around at different memory care, adult family home, and at that point, I just couldn't bear the thought of moving my mom to memory care or to an adult family home, because her level at that point was actually more or less advanced than most of the other residents in those facilities. And I just thought, well, she needs more interaction. This isn't, she's not really ready for this. So I actually resigned from my job at Stemelt Growers. I was in marketing and public relations there, and decided, well, I'm going to take care of my mom. So she moved in with me, and so I did that for about a year and a half. And in the interim of that, I went back to work part-time, and then I was asked to go full-time at the current agency where I work. And once I started working full-time, it was no way that I could take care of her any longer. Even though we had caregivers coming in the home while I was at work, we would take her. At that time, there was an adult respite care, which was great. At that time, it was at Grace Lutheran Church. That's right. And my mom really enjoyed that too. I would take her there while I was at work for a few hours, and there were activities and things, and they had closed several years ago now, and we don't have a replacement in town for that, unfortunately. So I did that, and then because it felt like I was working all the time, like go to work all day, come home, work all evenings, taking care of her. It was exhausting, and so I looked for an adult family home. And at that point, it was appropriate. It was appropriate for her to live in an adult family home. And and her experience there was good. When we found the right one, you know, we actually did have her in one, and then said, no, this isn't right, and moved her to a different one. So we had to find the right place, but that is where she passed away in March of 2011. So it was a very long road. It was very challenging, but I will say it was also very rewarding. So sometimes people don't talk about that piece about caring for your loved one, because it was like I got to give back to my mom and be very close to her during that time. And I was always thinking I'm the best caregiver, and I was, even when she was in the adult family home or assisted living, there almost every day, making sure, did she brush her teeth, did she eat right, I was vigilant about it. But I felt like I did the right thing, even though it was challenging. So I have a passion for this now, and I love to tell people about what we have to offer, because it makes what I did possible, much easier for folks. So I think it's really important information, and I'm really happy to be here. Okay, so aging in adult care, our main office is over in East Wenatchee. I don't know if any of you have ever visited. We are located right across from East Wenatchee City Hall, East Wenatchee Library, right there. And so we are what's called an area agency on aging. They are funded by the state and federal monies that are designed to help people maintain a life of independence and choice. Basically, to stay at home. That's what we were created for, to help people access the resources that they need and to help them remain at home for as long as they can. So while there are great facilities out there, we don't focus on those so much. We focus on the in-home care. So area agencies on aging exist across the United States. There are 13 in Washington State, and they are meant to, as I mentioned, to help people maintain the dignity and welfare of older individuals. So this is our service area. We cover 6 counties: Okanagan, Chelan, Douglas, Grant, Lincoln, and Adams County. We have 3 offices. So this is the East Wenatchee office, and then Moses Lake and Omak. And as I mentioned, we have a variety of services and programs. So we help people who are adults, disabled adults. When we say disabled, our definition of disability is mostly disabled by chronic illnesses or by, let's say, an accident. We don't have so many people with intellectual disabilities, although some of our clients do have intellectual disabilities, but we don't focus on that. It's more kind of a physical type of disability. And then cognitive too, related to like traumatic brain injury, stroke, Parkinson's, dementia, that kind of cognitive challenge. And then, as I mentioned, we also offer programs to help individuals taking care of relatives and friends. So that was me. The family caregivers is the term we use. We offer both Medicaid funded and non-Medicaid programs. There are income, asset, and functional criteria to qualify for most services. So functional is our word for level of need. The different programs sometimes require a person to actually need bathing, dressing, mobility, transferring, some of those types of care needs. Not all of them, but you have to have like 3 or more of that type of care need to qualify for some of the programs. Other programs are more of a chore type of program, because we do have a specific program called Aging Network Chore, and most of the people receiving that program. They just need a little help at home with housekeeping, you know, vacuuming, grocery shopping, maybe a little bit of meal preparation, chores, and that's why we call it that. They don't necessarily need help with bathing, dressing, mobility, transferring, those kinds of higher level needs. The Medicaid funded programs called Community First Choice and Community Options Program Entry System offer the most services to people living at home. Higher cost services such as home modifications, ramps, and lift chairs can be obtained. Clients participating have an AACCW case manager, that's Aging and Adult Care Central Washington, case manager overseeing their care plan. So, under this program, the person needs to have a pretty modest level of income and resources. So this is the program that provides the greatest variety of assistance, but also helps the people basically with the least ability to pay for their own care. So the financial criteria are a little bit strict, but as it mentions here, you can have that in-home care, you could have a ramp installed, you could have a lift chair. There's a number of things that you could have that you can't get on any of the other programs. Or you can't get less, or as many, that's what I mean.
But this depends on your income.
This depends on your income.
Okay.
And it also depends on that functional need, that level of care. So you have to have a pretty high level of need in order to qualify. We have 4 nurses now, and they are designated for those Medicaid clients. And so they do home visits. They go out and they mostly do things like checking skin integrity, making sure a person isn't getting pressure wounds, and then explaining if they are how to address that and prevent that. They do a lot of, like if someone is having trouble managing their insulin or their medications, they'll do some of that medication reconciliation for them. So that's one of the services that you can get in the Medicaid program that we can't provide in the other programs. CFC COAPS clients, so this is a Medicaid program, usually have fewer resources to pay for assistance and a greater need for high-level care. CFC COAPS is currently the only program that allows relatives or friends to be paid to assist the care receiver, except for spouses. Now, this has actually changed recently, so we'll talk about that in a little bit. But there are a significant number of people on the Medicaid program who have, let's say, an adult daughter or even a friend who they're being paid by the state to do the care. So that's really attractive to some people because they, you know, sometimes it's hard to accept a stranger coming in your home and helping you to take a bath or anything, you know, sometimes that might feel awkward. So sometimes having a relative or friend feels better to that person, and that is possible. And there's training that they go through, and then they are compensated by the state. And their number of hours that they end up being employed or providing care depends on an assessment that our case managers do to determine how much assistance the person needs. So like sometimes there might be someone who only needs what's estimated to be 80 hours of care a month. But then you might have someone with a higher level of need, more advanced medical conditions. Maybe they'll end up qualifying for 120 hours per month. So, and then that person who's the caregiver is paid by the state. The other clients who choose not to have a relative or friend, they get their care through a home care agency that we contract with. So we don't actually provide the caregivers per se. We have the case managers who do the assessments oversee the care plan, and then our agency contracts with the home care agencies, and they train and provide the caregivers. And all caregivers, even the relatives, friends that you might hire for your own care, they have background checks required to see if they have any kind of criminal background. And they have, and those are done, I think those are done annually to make sure they haven't committed a crime in the interim, right? And they are trained by the state. We have a program called Health Homes, which a lot of people actually confuse with home health. It's not home health. Health Homes is a program that we contract with some of the insurance agencies to work with certain customers of theirs who maybe are not managing their conditions very well, and they end up going to the emergency room all the time instead of just going to their doctor. So they're frequent flyers to the ER, and with this intervention from our health home staff, they end up being able to manage their health better and reduce the emergency room visits and reduce the cost. That's the main thing. I think the insurance companies are looking at, well, how do we reduce this cost? So we have staff who work in this program. Then we have a program that is also Medicaid, but the financial requirements, eligibility requirements, are more lenient than the other Medicaid program. So this program called Medicaid Alternative Care, Tailored Supports for Older Adults, it's quite the mouthful. We say MAC-TSOA, we use the acronym MAC-TSOA. It offers a lot of the services that the full Medicaid program offers, but maybe in a lesser quantity. So we have that home care, the caregiver who can come in. We now have, now it says we can't allow, okay, you'll see a slide here that will say we can't allow family or friends to be paid to do the care. That's no longer true. As of August, they changed that because it is such a popular thing. A lot of people want to have a family member paid to do their care. So now you can have a loved one. Now, it's still true that you cannot have your spouse paid. So on both programs, spouses cannot be the paid caregiver. But let's say a daughter or an adult son could. The program offers fewer hours of care. So really, I have never seen in our program any of our clients on this service have more than 40 hours of in-home care per month. So that's gonna be the maximum. And even that requires what we call an exception to rule. We have to request it. So the standard is 20 hours a month of care, which isn't much. It's not very much, but it's something. And the other thing is that in addition to that 20 hours, you can have one of the emergency alert buttons. You could have home delivered meals. You could have supplies like incontinence supplies, medical equipment, those things paid for. So those are available on the other Medicaid program. They're available on this program. But the main thing is those in-home care hours, those are less. Those are definitely gonna be less. And the ability to have environmental modifications like the widening of a doorway if someone becomes wheelchair bound, or a ramp, a shower modification, we can provide those on this program. They can be provided on the other program if they're approved. So we have to request it with the state, make our case for why it is necessary, and then hopefully they say, yes, we see that this is necessary, and they approve it. Yes?
Diane, do you see, sort of statistically, I can see folks, I've heard folks like, oh, I don't wanna go through all of that, or oh, that's a lot of trouble, or oh, ahead and take advantage of it. A difference in quality of life, time of life, lack of falls. Are there statistics that say it really is worth it to go ahead and work on some of these things, even though, yeah, it might be a lot of paperwork, or yeah, it might be bringing in some family, or there might be some extra this, that, or the other thing. But in the long run, what we see is people are less prone to fall, less prone to break a bone, less prone to end up hospitalized for something that could have been prevented.
Yeah, absolutely. Because the difference between reaching out for help and not is, I can't imagine if everyone decided, oh, you know, it's too much work. Because so many people, just from having a caregiver come in a few times a week to help them clean their house so they don't have to do it, to take them to a medical appointment and make sure they get there, and maybe we provide some grab bars for the bathroom and a medical alert so you can summon an ambulance in a timely manner if you do fall. You know, just if you can imagine the difference between your quality of life and the longevity of your life, and not ending up in the hospital and having hip surgery. You know, how many hip surgeries happen because people fall when they don't, that can be prevented, you know. We can get that ramp for you, or that grab bar, or that handrail on your porch, you know. Imagine the difference. So, and a lot of times, people end up not paying a dime for these types of services. So it's pretty amazing the difference in quality of life that you can experience. And that there's even more emphasis on that for people taking care of loved ones. I mean, there's statistics that show the caregivers, like the husband taking care of their wife, they end up passing away before their wife because they're so stressed out and tired, you know. And then what happens to the wife, right? So, yes.
Do you have suggestions? A question was left at the end of the last session of my person, parent, spouse, aunt, uncle, is not receptive to these conversations about their needs and our need to have some extra help. How do you broker those conversations?
Well, some of our staff members, they've been invited to like family meetings to try to kind of facilitate that conversation. Sometimes that helps. Sometimes, let's see, well, we have a program. It could be this program, Medicaid Alternative Care, or our program called the Family Caregiver Support Program. There are services available for the family caregiver, even if the care receiver doesn't want to have anybody come in the home. So let's say I'm the adult daughter and I'm really struggling because I need a break and my mom won't allow me to have anyone come and take care of her so I can get out of the house. I could go through some counseling. We have counseling available virtually to talk to someone about that. Like, and how can we as a family talk to her, you know, and convince her? What can we say? So we have that kind of support. There are some of the social workers that we work with closely through Confluence that are great at facilitating these kinds of conversations too. Like, I don't know if anyone's familiar with Tamara Steffen. Tamara Steffen is awesome. Yeah. And so if we encountered that situation and we say, hey Tamara, can you help us? She would. And then I'll tell you about some other things that we have. We have caregiver support groups, and we have a class called Powerful Tools for Caregivers. So those are also good classes and groups to go to talk to other people going through the same thing and to learn tips on how to have those conversations. So yeah, it's difficult. Yes?
most of these things that you're discussing right now, these services, are predicated on the fact that you would qualify for Medicaid.
Not necessarily, no.
But
Wait,
what you're discussing recently, just.
yes, right, the ones I'm discussing right now, well, the first one is Medicaid. This one is, Medicaid, but with a twist, kind of. It's, it has the ability to allow people to have more resources, like cash in the bank, CDs, retirement, more resources and a higher monthly income level, and still qualify. But it also offers less than the full Medicaid program. The way you can kind of think about it is, it's kind of tiered. Like the person who needs the most help is gonna be up here in the Medicaid program, because they have the least ability to pay for it themselves and the greatest need for care. And then you have MAC-TSOA, Medicaid Alternative Care, Tailored Supports for Older Adults. Those people are kind of right about here. Maybe they have too much income or too high of resources to qualify for Medicaid, but they still need some help. They still can't afford the $50 an hour for a home care caregiver to come in. There's a caregiver agency charging $50 an hour.
Yeah.
Yeah, now, that's how expensive it can be. So they get some help, you know, and then we have, I'll show you the Family Caregiver Support Program that's kind of here for people who are taking care of loved ones at home. And then we have our chore program for people who have the least need and have few resources as well. So we'll just keep going here and I'll talk more about those. So, okay, Medicaid Alternative Care, Tailored Supports for Older Adults provides, it focuses on those family caregivers, but it also provides a service for individuals who don't have a family caregiver. And family caregiver is the word we use that can mean a friend, relative, anyone helping someone who's living at home and needs some help. We use the term family caregiver. So it focuses on helping those folks with the respite and the counseling I mentioned. But those things are available for people who don't have a family caregiver. This program started out as what's called a demonstration about 6 years ago. They tried it out to see, can we do this? Is this gonna work? You know, for people who don't qualify for Medicaid. They're kind of in the middle. So they rolled it out as an experiment, kind of, a demonstration. And it was supposed to be focused on those people taking care of loved ones living at home. Well, what it turned out is there were a lot more people who don't have anyone helping them, who needed help. So I don't have an adult daughter helping me. My family no longer lives here. I have children, but they live across the country. I don't have anyone helping me. So lo and behold, we learned, look at all these people who don't have anyone helping them, who need assistance. And so we say it's focused on on the family caregivers, but really it's for those who don't have anyone too. Lots of services. Okay, so MAC-TSOA helps those who need care but do not qualify for Medicaid, prevents people from becoming impoverished in order to qualify for care. Sometimes people think, gosh, I have to have nothing in order to get help. This is a bridge. Offers a safety net for those needing care who are concerned about estate recovery or cannot afford a copay. So this is something MAC-TSOA is not subjected to estate recovery. So what that means is there's no chance that the government's going to come and take your home, right? People are always worried about that. Well, if I accept services, someone's gonna take my home. On this program, that's not a possibility. On the other Medicaid program, it's a possibility. It's not a given, but it's a possibility. So you don't have to worry about estate recovery. You don't have to worry about paying towards any of these services. There's no copay. And so it becomes very attractive to a lot of folks who are like, well, I'm gonna go that route. They might qualify for Medicaid and apply for it, but they don't like the sounds of it. Okay, so MACTSOA is based on the state's original family caregiver support program that started in 2009. Statistics showed supporting family caregivers dramatically improves their physical health, level of stress, emotional well-being, ability to continue as the unpaid family caregiver, and improves the relationship they have with their care receiver. So it was, like I was saying, MACTSOA modeled on this, and then, you know, we realized, wow, there's a need out there for lots of people. So we still have the Family Caregiver Support Program that started in 2009. And so this ends up being really attractive for people who don't qualify for Medicaid, don't qualify for MACTSOA, and have a family caregiver. You must have someone helping you in the home to qualify for this. So that could be, you know, like, even if it was your neighbor or your friend who lives across town, but she comes over and gives you a hand on a very frequent basis, they could be called your family caregiver. And we actually assess the family caregiver. It's designed to help that person, right? Continue doing what they're doing, designed to give them a break. And it has respite, those medical alert buttons, incontinence supplies, medical equipment, counseling, support groups. So what it doesn't have is a lot of those in-home caregiver hours. The standard is 12 a month, which isn't a lot. Depending on our budget and the person's needs, sometimes we can increase that. You know, so like this, a staff member might come to me and say, okay, I have a family caregiver, they really could use another 6 hours a month in their schedule because that caregiver is really tired and needs to get away. And I'll say, well, and why? And then I usually approve it. If there's money, I usually approve it. Okay, and yeah, number of respite hours is based on program funding and the caregiver's needs. Aging Network Chore. So I talked about this, and this is the chore program that has usually people, all they need is light housekeeping, shopping, meal preparation, laundry, occasional transportation and medical appointments. So that's available. And you know, I didn't mention, okay, let me go back here, oops. On this program, we use a sliding fee scale. So sometimes a person might pay towards the in-home care. And that's the respite service, depending on the sliding fee scale. A majority of people do not end up paying toward it because that sliding fee scale is really generous. And that is the only service in this program that a person might pay towards. And that would be by the care receiver. So let's say, if it's a married couple, we look at the married couple's monthly income. We don't look at their resources. So this is a really great one. If you have a lot of resources, let's say you have $250,000 in savings, we don't look at that. We only look at your monthly income to see if you qualify financially. And you don't pay towards any of the other services. So if you end up with a copay on the respite and you decide we don't want respite, we feel like we can't afford that copay, you could still have the other things. We could get you a medical alert button, some supplies, some medical equipment.
Dick Anderson, FaceTime video.
Okay, so there's that.
Dick Anderson, FaceTime video.
Dick Anderson, I know him. If it's the same Dick Anderson. Sheba? From Sheba? Oh, okay. Yeah, he's a persistent person, yeah. Okay. So 6 to 8 hours is all you might receive on the Aging Network Chore Program. And, let's see. If you are a single individual living at home, you have to have less than $10,000 in resources. So less than $10,000 in like cash, CD in the bank. If you're a married couple, it's less than 15,000. So that's, that's pretty,
On this one,
on this one.
okay.
So again, it's like people who need the least amount of help, right? That's it, that's kind of the way it goes. Sometimes people end up paying a copay based on their income, but again, not very often. We use that sliding fee scale again. It's pretty generous. Okay. We also have a kidship program because we are seeing increasingly that grandparents, aunts and uncles are taking care of children who are not theirs. They're taking care of their grandchildren or their nieces and nephews because their biological mom and dad can't. And most of the time, it's because of alcohol and drugs. I mean, I look at these forms that come in, like 98% of the time, that's what it is. And it's super unfortunate. God bless the grandparents and the aunts and uncles who take the kids in. But we have the ability to buy things like school supplies, clothing, household supplies, like detergent, toilet tissue, things like that. It's $500 a year for the first child and $250 per child after that. We literally have people taking care of 7 or 8 grandchildren. Yeah. So that is available. We have the Senior Farmers Market Program. Some of you might be familiar with this.
This is really cool.
Yeah, it's very popular. So you can receive $80 worth of basically coupons for free fruits, vegetables, herbs, and honey.
They have it on a card now,
Oh, that's
like
right.
a debit card, yeah.
It's like a debit card now.
Yeah.
You're right.
And you have a pin attached to it, so,
Yes.
yeah.
Yeah, it's great. You just go to farmers markets in our 6 counties or roadside stands, and those who are contracted with the state with this program, you could just get your fruits and vegetables for free.
Is that also Medicaid?
Not Medicaid. There are income requirements or eligibility attached to it, and I do not know what those are.
Okay,
It's not my program,
okay.
but it's very popular. Okay, other programs we have. So if all you need is home delivered meals, we can do that. If you are homebound, that's one of our criteria for just like, all you need is home delivered meals. A person has to basically have a considerable challenge to leave home to be considered homebound in order to qualify for home delivered meals. So I don't know if that makes sense, but like if you needed someone to help you with your mobility to leave home and then drive you to the store, you'd be considered homebound and could qualify. You can get just an emergency alert button if that's all you need. If you're 60 or older, we have a program. If you're 60 or older, you could qualify for that, free of charge. We have a special fund for minor home repairs, eyeglasses, hearing aid assistant, and medical equipment. So it's a very small fund, but we help a lot of people when there isn't any other resource out there. Yes.
I did this about a 1.5 years ago when I had hip surgery. You can qualify for Link Plus also, on a
Yes.
temporary basis if you can't drive for a while, or, and the home delivered meals are really good too. you know, so.
Yeah,
But it's just, you know, temporary, like 6 or 8 weeks or whatever you need, so.
that's right. Exactly. You could have a temporary need. You're homebound temporarily. Absolutely. Yeah.
Dan, do people need to sort of self-discern before they call you? Or can they just say, I don't know what I'm qualified for, I don't know which program I should be in, but I think it's time to consider help. And you guys, your staff helps them discern through what are you eligible for and where would we put you and what do you need in your home? Is that-
Yes.
Okay.
Yes.
And do you have a certain set of questions that you might offer to help somebody discern when it's time to call? Of if this is happening, if you're doing this, if you're asking that, this is a time when you should probably call and ask for some assistance.
You know, that is a great idea. We do not have a standard list of questions. We should come up with that. But it's definitely yes to your first question, which is just call, and we will help you discern if you need help and what we can do for you. And if we don't have it, we know the other resource in the community that we could send you to or connect you with. Yeah. So definitely, but that's our specialty, just call us, and we get that all the time. People say, I have no idea what's available, but my mom is really beginning to struggle, and we're thinking we need to get some help in there for her. Yeah, and call earlier versus later. We always wish people would avoid the crisis before they call, because we see that a lot too. And then they need help right away, and what they don't understand is getting all of this set up is not immediate. Especially if it's the Medicaid program. That one takes a really long time. It takes, they're like a couple months out now on people who can come and assess to see what your level of care is. So I really encourage people to think about it in advance. Also, think about it in advance in terms of, do you have a power of attorney? Yeah, or an authorized representative. And I know you have some people speaking on those topics coming up, which is really great. Because we see that a lot too. There's no one designated to speak on behalf of the person, to sign forms, to make any decisions when that person can't any longer. And that is a real challenging situation. Yeah. So, okay. And then we help, I see you have sale class here. We help with some of the funding for the sale equipment. So that's cool, you guys have it here. And then we do offer some transportation in areas that don't have a publicly funded system. So like Lincoln County and Adams County, they do not have publicly funded transportation. Whereas here, because Link is here, we don't provide that transportation. Except if you have a caregiver who takes you places. That would be the only difference. Okay, how to make a referral. Well, in the case of consumers, of folks like you, the easiest is just to call us. And we have a person assigned to take those calls and to talk to you and find out, okay, so what are your needs? What's going on in your home or in your parents' home or in taking care of your loved one? And then we will ask about your financial in general. Well, what's your income? What's your mom's income? Do you know does she own her own home? What are your resources? We have to ask those general questions to help you decide what's best for you, because you may not qualify for certain things. So we will ask those kinds of questions. We will do, for all the programs I talked about, we ourselves will do the screening and the assessment and the oversight of the case, except for the Medicaid program. Eventually, the Medicaid clients come back to us, but the initial process is you call us, we help you apply or help your friend or relative apply, we submit the application for you. And maybe if you need help, we help you get the documents they're gonna ask for. Because they are going to ask for bank statements, and they're gonna look at your, you know, what property you own and those things. They just do. The Medicaid program does that. So we can help you apply, but then there's another entity that then takes it from there. And that's the one that takes a long time. The other ones that I mentioned, those are in my department. My case managers are the ones who are going to do those assessments and screens and then oversee the care moving forward. So the best thing you can do is just give us a call. And that's where you would call. And this is our website. And there you go.
Do your programs work concurrently with hospice at all?
Yes, in terms of, well, it's nice because hospice provides some additional help, like they usually have a bath aide and a social worker, and so they have a little bit of help that can work in tandem with our programs. So yes. Let's see, so each of you in your little tote bag has these brochures. So we do a lot of referring folks to, like I said, to places where maybe we don't have the resource, but we know who does. And so these are the most frequently requested resources in this yellow brochure. This is our general agency brochure. Not really slick or pretty, but we print a lot of them, so we have to keep it cheap. Yeah. Okay, so I mentioned the Family Caregiver Support Program. That's this one. For people taking care of others living at home. That has that more lenient resource standard. So you can have quite a bit of money in the bank, no estate recovery for Family Caregiver Support Program. Medicaid alternative care, tailored supports for older adults, that's this one. Lots of paper, huh? Let's see, and these are ones I didn't talk about yet. But maybe some of you are already familiar with the Medicare Savings Program. This one is, we help folks apply for it. And if you are of a certain income level, you can qualify for help with your Medicare premiums and with your co-pays. The Medicare Savings Program, it's worthwhile at least looking at this. Let's see. If you are a married couple, you can earn up to $3,407 a month and possibly get help. So that's the highest one. If you look at program 4. If you're a married couple and you earn up to $3,407 a month, you might qualify for the Medicare Savings Program. So that's this one. It's actually a flyer we folded up. And if you qualify for this, you are very likely to qualify for what's called the Extra Help Program. That's this little brochure. This is help with prescription drugs. So, and it's really great because people who qualify for this, their prescription drugs are like paid for, completely paid for. So it's worthwhile checking it out. And then we do a little bit of just distributing information about some the various little programs that are out there that help folks pay for prescription drugs. That's this one. It's a lot of paper, I'm sorry. We kill a lot of trees in my agency. Yes.
Do you have, connections for assistive listening devices or, like tablets, or some of the conversation, aids? So if I'm hearing impaired and sitting in a room like this is difficult, I could use a microphone and it will transcribe what's going on so I can read the conversation while it's happening live, or that's sort of like TDD but not TDD.
Yeah.
Do you have those kinds of assistive listening things or helps or dollars to get them?
So, on the program, the Map to SOA program, we could do that. The Medicaid program could do that. For the other, needs, we can connect you with the agencies and resources that provide those. Yeah, there are assistive technology, I think it's state funded, there is assistive technology for hearing impaired with the state. And sometimes they can provide those devices. Other times they might just say, okay, this is the resource where you could buy one. But yeah. Yes.
For a couple that's wealthy, and that's not us, but I'm speaking to somebody else, is there anything you can offer them if they have a problem where the person being cared for is difficult? To have somebody come in and they don't know what to do and they're taking medicine to try to keep their nerves in check while I go through every day with them.
And so,
Can you help with that?
yeah, so the person is not wanting a caregiver to come in the home.
Right.
Yeah, so, so that's kind of what I mentioned along the lines that, well, for the person who's struggling and taking the medicine to try to cope with that, we could just go ahead and put them on the program, on the Family Caregiver Support Program, and then they could at least access some counseling, some, they could go to the support groups that we offer.
So those aren't income dependent?
No,
Thank you.
right, not income dependent, you're right.
Do they have it on the west side? Are there agencies over there?
Yes. We, the area agencies on aging in Washington all offer very, very similar programs. We all do.
So if we say, I have somebody in Tacoma who needs this kind of help, and we call your office, you'll give us the number for Tacoma to offer the reference to whoever's on that site.
Yes.
Okay.
Yes, that's right. Yes.
I had a question. You have some volunteer attorney services, and you have another one called Clear Astros Senior. Now, are these income dependent?
Clear is income dependent. They might answer some basic questions, but if they're going to do any measure of help, they will ask about your income. Volunteer attorney services, I'm not sure about that. They might have different standards.
They also have, they have open like office hours, so you can come in and they can pair you with whether or not their organization is the best based on your income, or they can refer you to somebody who can, and then you can get that free sort of moment with them to say, here's my situation, and then they can guide you for free.
Yeah.
I know.
She's a great wealth of information. Marissa, right? I was like, okay. We met last week, and you are the new executive director for
Wellness Place.
Wellness Place.
Wellness Place.
Oh.
Yeah.
Oh, nice.
If you have any cancer needs, come to me.
Yeah.
We don't want you to have cancer.
Any other questions? Okay, so I have these flyers over here, and I mentioned the caregiver support groups. So I'm just gonna start these around. We have one in East Wenatchee every month, and one in Chelan as well. Here's powerful tools for caregivers. This is great. I mentioned Tamara Steffen. She's one of the instructors. The other instructor is Joan Akers. She's a retired, she retired from the Alzheimer's Association. So Tamara and Joan teach this. Joan is also the facilitator of our caregiver support groups. So, two very experienced people. And let's see. This is coming up next week at the Wenatchee Senior Center. It's a senior health fair. All sorts of good information. There's one also in Leavenworth next week, and in Chelan. And